Are you not in the mood to have sex? Do you wait for your partner to go to sleep before you just so you can avoid it? If you're thinking to yourself, my sex drive is gone, well, I'm Dr. Janet Williams, the founder of the Confident Pleasure Program, and today I'm talking about low sex drive and low libido. If you're new here, I talk about gynecology, sexual health, menopause, emotional healing, getting your groove back, and so much more. So let's get into it. In this video, I'm going to be focusing on what low libido is and some of the reasons why it happens. So let's start off with what libido is. So libido, mojo, sex drive, these are all ways of describing desire. And desire is our interest in sex. It is our interest in sexual objects or activities, or our drive to seek out sexual objects or to engage in sexual activities. It's an aspect of our sexuality that varies from one person to the next and fluctuates depending on our circumstances. So it's very important to note that everyone has fluctuations in their libido. This is normal. And it's important to make the distinction when we're talking specifically about libido disorders. Now, there are actually two types of libido or desire that we can have. One is spontaneous desire, and the other is responsive desire. You can kind of think of spontaneous desire as an internal switch. So something inside of you gets stimulated and an urge for sex comes out, and that is spontaneous desire. And the scenario for this would be your partner comes home and they can barely get a word in edgewise and you're jumping up on them and it's on and popping, okay? It can be something inside that sparks you, something small, like seeing your partner across the room or doing some normal task and out of nowhere you're cleaning the house and suddenly you want to have sex. This is spontaneous desire, and we see this a lot of the times with a desire at the beginning of relationships. So spontaneous, internal something turns on and you're ready to go. Responsive desire occurs when desire for sexual interaction comes from an external environmental cue. So it might be inspired by physical touch, sensual massage, watching your partner undress, suggestive conversation, anything external that positively triggers that response. And that might look like your partner coming up behind you and you respond like, okay, babe, let's get it going. So that is our responsive desire. And it's important to realize that regardless of whether your desire is responsive or more spontaneous, they are both desire, both libido. And both are healthy forms of desire. They're just different. Women do have the tendency to be more responsive with their desire, and there may be some cultural norms and expectations that support that, and that's a whole nother video for a whole nother time. But it is important to note. So what is really going on when our libido disappears? Well, from a biologic standpoint, there's a couple of things going on. In the center of our brains is where our pleasure center lives. And this is where the brain ensures our needs are met. It's the area of the brain, along with some others, that releases dopamine. Dopamine is a neurotransmitter, chemical in our brains that is important for motivation. It's the driving chemical that drives us to seek pleasure and other goals. In addition to dopamine, there are a number of other neurotransmitters, hormones, chemicals involved in the desire and sexual function cycle. A few of these will increase our desire and a few of them will decrease our desire. Dopamine, as I mentioned before, is one of the ones that increases desire. Testosterone is a very important hormone for increase of desire. Norepinephrine and oxytocin are also important hormones of desire. On the flip side, there are a number of hormones, chemicals, and neurotransmitters that also will decrease or inhibit our desire. And that includes things like serotonin, cortisol, prolactin, and progesterone. And these are going to be very important, and I'll explain here how this works. There are multiple risk factors that lead back to these critical hormones and neurotransmitters. There are psychological risk factors like depression, anxiety, and impairments in our body image. Going through a very difficult pregnancy or childbirth can have some psychological impact. Struggling with infertility. All of these are psychological things that ultimately can lead back to some of the dysfunction that we're seeing with these hormones, chemicals, and neurotransmitters. Emotional blocks. There are a number of things that I've seen with so many of my clients that get in the way of desire. Unresolved issues, toxic exes from the past, painful emotions, difficult situations that are unresolved, past trauma. All of these things can certainly get in the way of our desire in the form of emotional blocks that just really need to be cleared out. Relationship problems. When there are issues in relationships, it can make it very difficult for that desire to be there. It can impact our libido. Stress is a huge one. When we've got so much stress going on, we actually do see increased levels of cortisol in the body. Again, leading back to those critical neurotransmitters and hormones. The stress goes up, the cortisol goes up, the desire goes down. Same thing we see with fatigue. If you're too tired, a lot of times that desire goes out the window. There are a number of medications that can cause problems with desire. SSRIs, selective serotonin reuptake inhibitors. This is a class of antidepressant medications. Very popular, very common, things like Lexapro, Prozac. The way that they work is by increasing the amount of serotonin in the synapses, in the spaces between the cells in our brains. And what this does is it helps to increase the level of serotonin in the body, in the brain, and actually causes an improvement in mood, improvement in the sense of well-being, which is great for depression. But increasing that serotonin, if we remember, will actually bring down our desire. So while it's a good medication on the one hand, it can cause some issues on the other hand. Birth control pills are another one. They can increase something called the sex binding globulin, which kind of holds on to the testosterone in the body and makes it not bioavailable. So even though there's testosterone around in the body can't use it. So it essentially, functionally decreases the testosterone and then can decrease the desire. So even though birth control pills can be good from the sense that you aren't worried about pregnancy, you may have some neurotransmitters overriding the baseline desire when you're on an oral contraceptive pill. And then there are a number of medical conditions like diabetes or high blood pressure or renal failure that can affect the blood vessels and nerves of the genitals that may cause numbness, which can in turn cause a decrease in desire. Any kind of physical condition that causes pain with sex can in turn decrease the interest in sex because of that association with pain. And so we can see, conditions like menopause, where there's dryness in the vulva and vaginal tissues, where we may see that association take place. I hope you enjoyed this video. To recap, responsive and spontaneous desire are normal and healthy. Low libido, hypoactive sexual desire disorder diagnosis requires that it's occurring for an extended amount of time, like 6 months, and causes distress. Neurotransmitters, chemicals, and hormones are important mediators of desire. Dopamine and testosterone are key. Stress, emotional blocks, medications, menopause, medical illnesses can all affect our biology and cause libido and desire problems. Thankfully, there are solutions. It's a very important issue, and I'm so glad to say that we do have solutions, contrary to popular belief. In a future video, I'll be getting into some of these solutions, but if you're ready to get your libido back on track right now and start living that blissful, intimate life that you deserve, you should register for my free webinar. The title of it is The 3-Part System for Boosting Libido and Igniting Confident Pleasure at Any Age. So go ahead and click on the link around this video and register today. And I will see you soon. Thanks for watching.